Doctors and nurses, despite knocking before entering a patient's room, what's the strangest thing you've walked in on a patient doing? Not super strange overall, but unexpected. Labor and delivery unit saw from the main monitor at the desk that one baby's heart rate had stopped tracing on the fetal monitor. It happens sometimes with position changes during labor, so we went in to go readjust. Patient is sitting there, cleaning the just-born baby off with the sheets. Looks at us like nothing's wrong. Didn't even ring her call bell. Next story. Woman giving her husband some oral pleasure, except that she was the patient in the burn unit, admitted after a flash fire from pouring lighter fluid on her barbecue. All the hair on her face was singed off, her face was super swollen and red, and we had caked on antibiotic ointment all over her face to treat her burns. Talk about sloppy head. Next story. I had a patient who kept pulling his IV line out because he said he couldn't get up and move around while attached to the IV pump. He had done it a couple of times a shift for a couple days, and he was a hard stick. I told him he needed to use the call button to ask for help unplugging the pump, etc. if he needed to get up. I also sternly told him that under no circumstances was he to pull the IV out of his arm. Again, he needed the fluids, he needed the medications, etc. Well, a couple hours later, I walked by his room, and it looked like someone had been slaughtered in there. The bed was soaked with blood. Blood was splattered on the walls, the furniture. There were pools of blood on the floor leading to the bathroom. I went into the bathroom, and there he was, standing at the sink, washing his face with blood pouring out of his IV tubing that he broke so he could get up. I quickly tied the tubing to stop the bleeding, and he seemed dumbfounded about what the big deal was. Looking right at me, he said, "You said not to pull the IV out of my arm, right?" Next story. Paramedic. I'm not even sure what strange means anymore, but walked in on a dude with a left hand full of poop and a right hand full of his privates that he is furiously self-pleasuring. All right, man, just make sure you get in the toilet when you're done. Still pleasuring. Which one? Yeah. Next story. A patient was in the middle of self-unaliving by jumping from the 5th floor window. Several steel beams lay on the outside ground beneath. The patient had ripped out his catheter and broken the first of 2 glass layers in the window when I found him. He was standing on a dinner table with cut-up feet. I don't know how, but I lifted him down from there as if he were a stubborn child. He had been operated upon for a hemorrhage and was confused. Next story. OBGYN checking in. Drug-addicted man going down on his girlfriend. One day postpartum. Think Walking Dead. Another drug addict injecting into her IV. Preterm labor patient with dilated cervix at 24 weeks having what can only be described as adult star-level aggressive intercourse. Next story. 1. Parents having relations on their hospital bed with their 15-year-old child, the patient, sleeping right next to them. 2. Child putting Play-Doh in the Jackson Pratt right after having a liver transplant. 3. Nurse kneeling in front of a teen patient, had the patient's back to me so I couldn't see what the nurse was doing, and the patient says, "Yes, that feels good this way." Turns out she was only changing the bandage on his ankle, thank God. 4. As I opened my patient's door, I can only see the doctor dancing on furniture. Next story. Not a doctor or nurse, but I am a police officer. We were going to calls at a hospital for a dispute. Walking through the halls of the hospital, I heard someone yell, "Officer, help, help!" I walked into the room that the yelling came from, and there was a little bald fat man self-pleasuring violently, just looking deeply into my eyes, snickering. He freaking tricked me. Next story. Working in neuro/psych, the strangest thing I've walked in on was a fully cognitive 18-year-old male having intercourse with his biological mother. It was all consensual, and they both seemed to be enjoying themselves. However, needless to say, the mother was denied a private presence and given limited visiting hours after that. Yikes. Next story. I walked into a quadriplegic gangbang with the worst pressure ulcers I have ever seen. Lower back, both hips, bones completely exposed, septic wounds, all of them. All getting a lap dance from his underage girlfriend, who was topless, rubbing herself against his flaccid, fully cathetered chicken. I stood there for a second, turned around, closed the door, trying to understand what I had just seen. The girl got dressed, walked past me as fast as she could. When I entered the room again, the patient just said, "She missed me, Doc. What can I say?" Next story. Two teenage girls in a children's hospital for sickle cell were in the same room together and were discussing the nice things that their pimp bought them. One girl had received a nice handbag, and the other one had received something less nice. They then, after more discussion of their pimps, realized that they had the same pimp, causing the girl who got the worst things to try and steal the other's handbag, saying that she deserved it more or something. This led to them fighting and pulling out each other's central lines. It was a bloody mess, but one of my favorite stories. Gotta love Oakland. Next story. Not a doctor, but paramedic. I spent some time working in the IMCU early in my career. I was monitoring patients' telemetry, basically like watching an EKG for 12 hours, and noticed our recently trached had a hole cut in his neck to allow him to breathe. Patient's heart rate was increasing and he was having abnormalities in his EKG that were not resolving. Paged the nurse. She knocked on the door. Upon entering, found his wife riding him hard. She was like a deer in the headlights, slowly backed out, terrified. It was hilarious for us, but definitely not expecting the guy's wife to be on him while he had a new trach. But hey, that's love. Next story. I'm a hospital chaplain. I was sitting at the nurse's station in the cardiac ICU, and we kept hearing rhythmic thumping coming from one of the patient's rooms. When we entered, we saw the patient sitting on the edge of his bed with his Foley bag in his hand. It was still inserted. Upon asking what he was up to, he told us he was fishing. Then he tossed the Foley catheter bag away from him across the room. When it hit the end of the tubing, it stopped, fell to the floor, noticeably self-pleasuring his chicken underneath his gown, at which point he pulled it back, like a fishing line, and proceeded to repeat. The nurse, a grizzled old Navy vet, chuckled and asked how the fishing was. Good. The nurse tells him to stop or he's gonna hurt himself. He doesn't really want to, but eventually we do talk him into it. After we get him back in bed, the nurse asks if he has any pain. The patient responds that he never felt better. As far as I know, he didn't go back to his fishing though. Altered people do some strange stuff, but at least he didn't rip it out or do any serious damage. Next story. First internship in a geriatric ward. Me and a fellow student walk into a patient's room who is screaming like crazy. He was known for having serious dementia. We open the door, and my student colleague gets a warm handful of crap thrown right in his face. Needless to say, I was quite surprised, but happy that I missed said brown rocket. Next story. Worked labor and delivery one night. This younger, about 16-year-old girl was in labor and had pregnancy-induced hypertension. She was in the room with her boyfriend when we heard him scream. We ran in there to find her, giving him head, which isn't all that unusual, I guess, in hospitals. But see, here's the thing. If blood pressure gets high enough, people will have seizures. And when people have seizures, they tend to bite down very hard. We basically had to pry this girl's mouth off of his chicken. Well, they weren't wrong about all the intimacy being pretty typical in hospitals. Feels like every story so far has been sexual. But that poor girl, though. And the guy, too. Thanks. Dun, 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 dun. Next story. I'm a clinical laboratory scientist. But in school, I had to do a phlebotomy rotation. I would follow a phlebotomist in the hospital as she did her rounds. The weirdest thing was dealing with crazy patients. The phlebotomist was black, and I vividly remember an old lady calling her a filthy blank and screaming to her husband that this Yankee blank is trying to sell me shoes. I do not want any shoes. One of the creepiest things was that one night we walked into a patient's room. It was dark, and we realized the room was empty, or so we thought. When we turned around, the door eased closed, and we realized the patient had been hiding behind the door. She was an older woman, maybe late 50s, with long, greasy white hair down to her waist. She looked at us with pure hatred and scared the absolute crap out of us. Then the phlebotomist said, "Mrs. Johnson, we are here from the lab. We are here to draw your blood. Is that okay?" And the lady just said, "No, get out!" And we noped the F out of that room. Next story. Okay, this is the weirdest thing that I have seen a patient do. Gather around, boys. It's backstory time. So, I am a fifth-year medical student in Egypt. One day I entered the classroom, and there was someone teaching the cardiac symptoms in English, and the whole time I was confused by his clothes, and I thought to myself that the teacher looks like a homeless guy. Then suddenly, he asks for a student to come closer with his stethoscope. Guy takes off his clothes, and on his chest is a giant open heart. I then realized that he is actually a chronic patient who knows medical terms and symptoms of the cardiac diseases by heart. So, too long didn't read, walked in a classroom, and the patient is teaching the crap out of aortic stenosis and mechanical valve sounds. Next story. We once had a patient with borderline personality disorder in the ED. He pressed the nursing call button and positioned himself standing on the end of his bed, bent over, hospital gown pulled up, bare butt cheeks facing the door. When the nurse walked in, pulled aside the curtain, the patient let out a blast of diarrhea that splattered all over the nurse. Oh, that poor and obviously very shocked nurse. Next story. During my first clinical rotation for nursing, a classmate of mine did an assessment on an older patient. Came out saying, "She is absolutely a self-unaliving risk. I'm getting her actual nurse." Turns out the patient's husband had passed away, and she was talking about how she missed him, along with saying things like, "I'm just tired of doing this. I just want to see him again. Life just seems pointless now." And these are huge red flags for a self-unaliving risk. The classmate asked another classmate to go in and stay with the patient until the nurse could come in to check with her. When the other student walked in, the patient had a handful of her blood pressure meds. She dropped them on the ground, started crying. First time ever being nurses, and we have a patient almost unalive herself. It was absolutely insane. Next story. At a retirement home for elderly folks with severe dementia, there's this one guy that is always silent but cheery. Always smiling, waves when you acknowledge him. One day out of the blue, he stops me in the hall, raises his finger toward a room with the sternest scowl I have ever seen. He says, in the deepest movie trailer narrator voice I have ever heard in person, This is the room." Upon entering the room, I found that he was directing all of the wandering residents into this room and had like 4 people crammed into this little studio unit. Coming soon to Disney DVD. Or maybe not, it might be a bit of a awkward flick. Next story. Sex. Terminal patient banging her boyfriend in the hospital bed at like 7 a.m. I can't blame her. Second place. Patient in the process of falling out of bed trying to reach a box of donuts and some fried chicken she had hidden under her bed. I think she also soiled herself when she hit the ground, but I can't remember. See, even in the worst of times, America still runs on Dunkin' and diarrhea. Next story. Not me, but my mom is a nurse that works in intensive care. She told me about this one patient who wouldn't talk to anyone except for one of her coworkers, Debbie. So naturally, Debbie was the one who always got this patient. When he spoke to her, he would be sincerely sweet and super nice, always trying to be a gentleman. Well, one day, Debbie wasn't there, and my mom went in to go take care of the man. When she went to check on him, he was scribbling on a notepad, and as he noticed her, he tried to hide the notebook and accidentally dropped it on the floor. My mom picked it up, and as she handed it back to him, she skimmed over what he had written. For days, he had been scribbling in the dark, "F Debbie, kill Debbie," and disturbing stories about unaliving her. He was transferred to the mental ward shortly after. Next story. I had a patient with dementia who constantly carried around a Bible. Apparently, I resembled her daughter, and she would call me by her daughter's name. Every time I walked into her room, she would scream at me for effing some random boy, I guess, and then she would hit me with her Bible. It was an interesting shift, to say the least. Next story. Wasn't me, but a nurse I worked with walked in on a patient and her visitor doing the dirty. And by dirty, I mean dirty. Imagine the amount of gross crap that's gone down in an ER, not to mention the woman wasn't, exactly ladylike. Turns out the patient was a hooker that would occasionally bring her Johns to the ER to have intimacy with. She knew to say she had a lady problem, so that she got a room with a door, and that's kind of in the corner. I guess if you need a room with a bed, the ER isn't a bad place, although possibly the grossest setting possible. Needless to say, whenever she checks in now, she no longer is allowed to close said door. In a slightly related story, there was another guy who was so tall that he would stand up and see above the height of the curtain. He also happened to be a chronic self-pleasurer. He'd either call the nurses into the room so they'd see him going to town on his own privates, or he'd stand up and stare at all the nurses while he did it. He's also not allowed to close the curtain anymore. Next story. This happened to another nurse. The married father of a 12-year-old patient who just had open heart surgery and was heavily sedated was hitting on a nurse I work with. At 10 p.m. he mentioned she looked stressed and offered to massage her. She declined and laughed it off. At 12 a.m. she went back in the room and he tried to massage her back without asking. She told him no in no uncertain terms and figured that was the end of it. At 4 a.m. she walked in and he was standing there naked, tried to seduce her. She called security, who then called his wife, explaining to her why she had to come pick her husband up at 4 a.m. in the morning and why he was no longer allowed in the hospital. Next story. EMT. Had a call for a protruding object, so my partner and I rushed to the patient's apartment. When his SO opened the door, we saw him lying down with his butt sticking up and a blanket covering. There was something protruding from his anus. We peek under the blanket to see a thawed fishtail sticking out of his butthole. Story was they tried butt stuff with a frozen fish and the fish thawed with the body heat, and the scales got lodged in his anal cavity. Funny part was as my partner and I rolled him into the ER, my partner hummed the theme song to Jaws. I lost my crap. I'm uncomfortable. Next story. Paramedic. Germany. Nosfalsanatiatia? That can't be close. We take our long words seriously. LOL. Last week get a call to pick up an elderly lady from the hospital and drive her to another hospital to get her TEP, hip replacement. We walk in. She's there with a young guy she introduces as her great nephew and who helps her put her stuff together. We tell her to pack up, go get her paperwork started, and I go back for her to sign the transfer papers, insurance mostly. Knock knock. Open, she's on the bed, playing with herself and giving some head to the guy who's standing next to it on his tippy toes just so he can reach her. I did a double take. Told the guy that he could press the button to lower the bed if he wanted to. He didn't have to stand on his toes. And I gave them a few more minutes. Next story. Strange but understandable, as the patient was very confused and quite old and on some good stuff. Walked in to pick up a tray. I'm food service. And the patient had his knife, just a butter knife, and was trying to saw out his catheter. But up higher than the exposed part of the catheter, I convinced him to give me the silverware before he could cut through his chicken, or at least lacerate a pretty good part of it. And I hit the call button, made sure nursing knew what was going on. Seen plenty of other strange things, as the floor I work on is the psych floor, and another wing is oncology. They're often on some strong stuff, and also brain cancer makes you do some odd things. This one just stuck out the most. Next story. This question again. Psych patient went off his meds, set himself on fire. The surgeon cleaned up his wounds and stapled cadaver skin to him, harvested from organ donors. So I walked in on the patient peeling off, sucking down the cadaver grafts like salami potato chips. There was much lip smacking and finger sucking, but you know what? I wasn't amused. I don't really feel like telling that one anymore. Unfortunately, another one was OB rotation in an urban hospital. Walked in on a new mother sitting cross-legged in the bed, infant draped face down across her lap, screaming, while mom is eating Doritos, covering the kid in a fine dust of cheese crap and smoking a pipe. The nurse was upset. Apparently they were waiting on social services/DFACs to show up. Next story. I am an L&D/postpartum nurse. I was taking care of this very sweet but clueless when it comes to newborns, recent Chinese immigrant couple. They were both grad students, so they weren't stupid, but I don't know what the heck they were thinking half the time when they were attempting to take care of this baby. I hear the baby screaming his head off from the hallway, so I decide to go into the room and see what's going on and maybe if I can help them out. I walk in and the dad is in his underwear. With gloves on, he squirts 2 syringes full of colostrum, early breast milk, into the baby's mouth as the poor baby screams his head off, half chokes on the milk that makes it into his mouth, and the baby's completely naked except for his diaper, which was on backwards, lying flat on his back. I walk in immediately like, no, stop, now. And the dad just looks at me and yells, "Why is he crying so much?" I do everything and he's still crying. Mom was just silently sitting in the bed, looking at the floor. I had to gently explain that 1, the diaper was on backwards, and full. 2. Babies need to wear clothes and be wrapped up in blankets or they're going to get cold and very unhappy. 3. You can't just squirt liquids down a baby's throat while he's laying on his back or he's going to choke. I didn't even touch the subject of it being weird that he is just in his underwear or wearing gloves to take care of his own baby, but I really hope they had help at home. I tried my best to teach them as much as possible, but they were very, very strange. Every time the baby cried, they'd call me and say, "Hey, baby's crying," and just hang up. I'd go to the room, swaddle him, pick him up, and he'd be quiet. And then they were like, "Wow, how'd you do that?" Next story. Not a doctor or nurse, but I worked in mental illness in treatment as a therapeutic specialist for years. The psychiatrist that ran the show for a set of SA victims prescribed them sex toys to handle their urges. This unit was for adolescents, usually around 14 to 16. I went to get one of the girls for activities time, and sure enough, she hadn't followed protocol for happy time by leaving a note taped to her window, and I walked in on her going to town with one of the toys. Yeah, that was an interesting incident report to write. Next story. Girlfriend is a nurse. Does not have a Reddit account, but wanted me to post this story, so here it goes. I had a patient that was 60 years old, a constipated woman, and she was in the hospital for a couple of days trying to get help for her constipation. We had tried everything from enemas to laxatives, and nothing seemed to work. I went into her room to give her an update that we were going to call her doctor, and that's when it happened. She was lying on her side with her butt facing the door and her hand dug into her a-hole, digging out handfuls of crap with her fingers like an ice cream scooper. I kind of just looked at her, not knowing what to do or say, but the look on her face was one of pure joy and satisfaction. Needless to say, she got it all out, and the entire bed was covered. No corn, though, so hey, I know that because I was the one who had to clean it up. Too long didn't read, walked in on the human pooper scooper. Next story. My wife is a nurse, and two stick out in my head. The first being a guy from a psych ward in for some kind of virus. Her and another nurse knocked and heard "ready," so they went in. It was at this point that the patient says, "Aim." They walk in to be met 10 feet away from his brown eye pointing right at them. He was on his back, both legs pulled back over his head, butt cheeks spread, and before they could respond, he yells, "Fire!" and proceeds to projectile crap towards them. Luckily, he must have misfired and only made it about 8 feet out of the 10. They said nothing, left the room and bribed another nurse and tech to go clean it up. Cost them a pizza for lunch. The second was walking into a delivery room when the mother-to-be, who happened to be 350 plus pounds, explains to her friend how she had her mom and brother hold her legs so her husband could get her pregnant. Nurses need to be paid oh so much more. Next story. Hard agree, dude. Hard agree. You know, reading these stories, I usually love an awkward moment, and I'm no stranger to a funny poop story. I find them quite enjoyable most of the time, but not when it's an innocent nurse or somebody who has to deal with the other person's fecal experimentations. I just feel so bad, man. You know what? If you're a nurse out there, hey, we appreciate you. And if you know a nurse, hug them. Say sorry. Buy them flowers. Let's have a happy, appreciative nurse day. Next story. Worked in ER registration, collecting patient and insurance info when they wanted to be seen. Often I'll visit the room twice, once to collect info and the second time to put the armband on the patient. I registered a female patient, and when I returned with the armband, I opened the door to see her boyfriend going to town on her. Down there, female patient was wanting to be seen for her green vaginal discharge. Yeah, well, I'll never forget that look. Next story. I admitted this elderly bedridden patient who had a daughter with him. She claimed she was his caregiver. I was about to find out how true that was. I'm at the desk when he goes into V-fib. We bust in there with the cart, ready to save this dude's life. We throw the curtain back and this lady is pleasuring her dad furiously while he lay in the bed, having just died. We coded him, but to no avail. After the code, my charge asked what she was doing. Her response, whenever he gets worked up, it's the only thing that really calms him down. That was my first experience with not being able to even. Next story. I had a CNA certificate and worked as a third shift CNA in a dementia ward during college. I thought it would be a quiet job, but apparently that's when all the weird stuff happened. I had one patient that popped out his eyes. I knocked on his door just for the bi-hourly wellness check, and he didn't respond. Walked into his room and he was just sitting on the edge of his bed like he was waiting for me. I had to write the incident report after the nurse popped the eyes back in. He said a ghost told him to do it. An older lady with Alzheimer's that was giving oral to another resident, she apparently followed him all around the nursing home because he looked just like her husband. I felt so bad having to report this incident to the husband. It is required to notify kin when incident reports occur in my state since he faithfully visited her twice a day, every day. Next story. As an ICU nurse, we get the super sick, which also sometimes means the super crazy. Here are a few off the top of my head. A gal who had a catheter in her femoral artery for vascular surgery standing beside her bed, crapping on the floor. She was supposed to be laying completely flat in bed to prevent that cath from being pulled out. When we yelled at her to stop, she just looked at us in the eyes and kept pooping. This one wasn't me, but a friend. She had a patient selling drugs from her hospital bed. I guess a number of people just kept coming and going from her room at all hours, so they got suspicious and called security. We had this paraplegic who would come and see us every other month. He would unpack his white glove, and we would get the heck out of his room. We only walked in on him rubbing one out once, but that was enough. Yeah, that white glove still haunts my memories. Had an alcohol withdrawal who was severely hallucinating and just wanted a cigarette. Higher level management caught me in there with her smoking. Yeah, I gave her an unsharpened pencil and let her puff away. We got some strange looks, but she wasn't screaming and was pretty content. So I was happy. That last one feels like it could be something out of the Magnus archives, you know? In the psych ward, somebody's just asking, "Do you want a cigarette?" Next story. A policeman in the ICU after an emergency cardiac surgery, stashing a wad of several $1,000s after being visited by cop buddies. TBI patient that was barely communicating, self-pleasuring in our open ICU and full of many people. Despite being yelled at by the nurses, he managed to finish. Lots of walking in of every kind of person, peeing and pooping as well. Next story. A complete rundown of the following. A man sleeping in bed while his postpartum, that means just had a baby wife, was sleeping in the chair. A 17-year-old diagnosed with chlamydia in his elbow getting a beach from his 16-year-old girlfriend. A dead overdosed girlfriend by the side of her boyfriend who he himself was there also overdosing just hours earlier. Many self-pleasuring patients, whether demented, mentally challenged, or just plain stupid. A 400-plus pound patient with a small bowel obstruction that was being prepped to go to surgery urgently had 2 Burger King bags and a pizza smuggled to him. A mother fist-fighting her daughter because she overdosed on some drugs that she stole from her mother in the first place. The mother tried to steal the girl's cell phone to sell it for more drugs. She was later then kicked out. But surprise, she later tried to sneak back in by calling 911, coming in by ambulance Jason Bourne style, and tried to sneak into the room to steal the drugs back again. She was arrested. This guy wrote the whole thing like a 5 o'clock news report. I hope I did you justice, man. Next story. Worked as a tech in a local hospital. One night, a woman came in via ambulance in full cardiac arrest. She died a little while later. After she passed, myself and another tech were told to go make her presentable for the family. You know, remove the tubes, needles, straighten her sheets and gown. She was a larger woman, so we were bent over her going about our tasks when she moved. Not a little, a lot. As in she almost sat up. She was having post-mortem spasms. I think it's called Lazarus syndrome. Anyway, we freaked the F out, ran screaming from the room. All the doctors and nurses nearly peed themselves laughing. Thankfully, the family had not arrived. Next story. Okay, I'll play. Several years ago, I worked in a skilled nursing facility. It was basically like a physical therapy rehabilitation, nursing home, hospice care, post-surgical recovery, all rolled into one. This patient had Parkinson's and AIDS. He was also bisexual and hit on every single nurse who went into his room, man or woman. I worked night shift, and one of his pickup lines on me was that he thought he died when I came into his room because he saw an angel. One night I was making rounds, nursing assistant, and needed to check if he needed to be changed or cleaned up. I knocked and said, "Hey, can I come in?" I can hear his bed making noises, but they're pretty noisy. He has Parkinson's. He says, "Give me like 10 minutes. I say okay. I come back in 10 minutes later. Knock again, he gives me the okay and I come in. Well, he's completely nude. Gown is balled up on top of his pelvic area and he's smiling up at me. The whole time I'm cleaning him, he is the perfect gentleman. He's also fully erect and I have to pretend I don't notice and carry on conversation. We also both understand that he just self-pleasured and nobody says a word." Next story. I have a story from the patient's perspective. I was in the hospital with an appendix problem. Surgery went well and I was going to be allowed to leave after one night. The morning I was set to leave, I'm completely doubled over in pain, but they wanted to make sure I could walk before I was allowed to check out. I do so like a 110-year-old man and I finally get the okay to leave. Well, being unable to hardly even move, I asked my mother to put my socks on for me, which she proceeded to do. At this moment, a nurse walks into a slightly open door with my mom bent down and myself standing in front of her. The nurse exclaims, "Oh my gosh!" To which was followed up with, No, I'm his mother." It took the nurse a moment to realize I was not getting a beach from my own mom, but instead was just getting helped with my socks and shoes. I was, of course, still in severe pain and laughing brought out the worst of it. So my mom and I both had to do our best to forget about the situation and not speak of it until I could handle the pain of hysterical laughter again. Next story. Responded to a very flamboyant AIDS-related dementia patient standing on the bed warding off his family by urinating, spitting in circles, screeching like an eagle, and flapping his arms. Bonus, he had inserted his heart monitor box into his anus and had the cord trailing out, which made him appear to have a tail with all 5 of the electrodes flying in various directions. He had also pulled his IV out during the spinning and had painted all 4 walls and his family with blood. As I am walking in, the patient's brother begins screaming at him to stop acting like some stupid chicken bird and proceeds to tackle him, pinning him to the bed so that we can reset the crazy for the next hour. Too long didn't read. Male patient inserts square peg, telemetry box, into round hole, anus, stands on bed, rips out IV, and spins in circles, screeching like a bird. Next story. Very early on, when I was still a graduate RN, I looked after an elderly, confused man who had just come out of surgery for a hip replacement. Me, being the well-versed and experienced nurse that I was, thought it would be a good idea to leave said elderly, confused man in his bed unattended. With an IV in situ, a surgical drain hanging out of his waist, a urinal catheter attached to him on one end and the bed on the other, and in my infinite wisdom, I also put the bed rails up, along with the actual height of the bed being at its maximum so that the patient was almost, figuratively, touching the roof. Cue me walking back into the room about 10 minutes later to find the old poor guy on the floor, bleeding out of his now ripped out IV site, oozing blood and muck from where his drain once was plugged in. And on top of all that, the height from which he fell from the bed meant that his catheter had so forcefully been torn from his chicken that he was now bleeding profusely into his scrotal sac, making it swell up to the size of a grapefruit. I'll never forget those poor confused eyes looking up at me as if to say, "You stupid idiot, why do you do this?" I still feel awful. I'm pretty sure he needed another operation too. I've got plenty of bodily fluids related stories, mostly feces related, but I'm not sure if they are as epic as the one above. Next story. Worked with Alzheimer's patients for years and worked mainly midnights the whole time. One night while watching Impractical Jokers, I hear the one other aide scream for me in the other side of the building. I go see what's up and find her in an old man's room, and the room covered in blood, like you killed a chicken and ran around. The old man is pulling up his pants, smiling, while blood is pooling at his feet. I ask what happened. Notice an inflated catheter in his garbage can. That's when I realized he ripped it out, and I told him to drop his pants. When he did, you could see that the ball was a bit still too big for his manhood to manage, and it spilled like an overcooked hot dog. It was bleeding all over the place. I had to hold the privates together and call 911 while the 18-year-old coworker screamed and then threw up. It was a long night. Next story. I worked in a hospital for 5 years, making and delivering food, so I've walked in on plenty of crazy stuff. One thing that's especially burned into my memory was walking in on a 93-year-old woman butt naked trying to crawl over the safety rails that were installed on her bed to keep her from escaping. She was probably 7 feet up in the air and would have unalived herself if she fell. Ran out and screamed for a nurse, and 3 of them came running in to get her down. They told me they had installed the rails because yesterday she had ripped off her hospital gown and was running through the hallways. Another time I walked in on an elderly lady sitting on a portable latrine. The hospital gown was on very loosely, and when I went to set the tray down, I got a glance of the most horrific side boob I'd ever seen. Her breasts were sagging so low they went past her hips and into the latrine, which had been used and was full at the time. So I mentioned it to the nurse on my way out, and I later overheard that nurse talking to the other nurses at the station about having to clean feces off the patient's nipples. Next story. A woman leaning over her mother-in-law, siphoning liquid from her MIL's feeding tube. Long story short, she wanted her gone to get the house that was going to her and her husband after the woman passed. She thought a good way to hurry it up was to pull the woman's nutrients and get her to die quicker. We still don't know how many times that she had done it, but she was a frequent visitor to the old lady's room. It was a rough day with police involvement. The patient was a sweet old lady who was passing away from old age, and we had her there for over a month. One of my colleagues ended sobbing her heart out in the break room. I walked out, called my mom, and told her immediately I wanted to change careers, that I couldn't be around cruelty like that when my whole adult life had been dedicated to helping people. She talked me down, but it took a long time for the anger and the cynicism to go away. Next story. Didn't witness, but heard from a friend. It was mealtime at the facility, and my friend said she'd usually walk around to check up on the patients who preferred to eat in their room. She walked in on 2 old ladies. One was eating with gusto. The other sat quietly with her tray full of food untouched. My friend asked the second if everything was okay. The patient says everything was fine. My friend asked, "Why aren't you eating?" The patient said she was waiting for the other lady to finish so she could use the teeth. Next story. Late to the game, but here it goes. I work as a mobile x-ray technologist, and when I went into a nursing home to get some spine x-rays done on a woman in her mid-70s, I knock and announce who I am as I enter, and she has a gentleman caller on the bed beside her. The curtain was partially pulled, and notice her pants are pulled down to her thighs. And then I see that this old dude is blasting that dusty thing like a jackhammer. I explain I need to get the study done. He can come back when I'm done in about 10 minutes. He gets upset, obviously, and gets up to walk out of the room. He walks towards me and says, "Thanks for the block, a-hole," and shoulder checks me. The guy was probably her age, if not older. I felt bad, but I had a job to do, you know? I can't be waiting for him to clear the cobwebs out of her while I have patients waiting. Next story. I was doing my clinicals at Walter Reed for my LPN through the Army's program, and was working the orthopedics floor, which is mostly wounded guys at the time. There was a guy there that had stepped on a landmine and broke his ankle. Yes, luckiest dude ever, but it gets better. He was a stereotypical Southern guy who looked like he'd been beat as a child with the ugly stick. Nice guy, though. His wife is coming to see him, and when she shows up, she's a perfect 10, half Asian. I'm thinking, dang, this dude just gets all of the luck, huh? I go into the room later to make sure he's alright, just doing my rounds and whatnot, and she's giving him the beads like it's the last day on earth. We eventually settled on a system of me knocking, waiting for a bit, and then opening the door. I walked in on them in various positions several times before I just talked to them about it. Made sure they got the other nurses who wouldn't mind either. Wounded guys deserve a good one, you know, every now and then. But on a side note, we used to get escorts for the guys who needed to, have their troops supported, to say it. Even found one who was fairly attractive. Didn't mind amputations and had a medical background, so if crap went sideways, she knew what to do. Escorts can be very classy ladies, by the way. Alright guys, that concludes our stories of doctors and nurses who have to deal with so much crap, and a lot of it is actual literal crap, some blood, and mostly just various embarrassing and uncomfortable positions. But guys, pour one out for the nurses. Thank the nurses, hug the nurses, tip the nurses. Do what you got to do because you guys are dealing with a lot of stuff, and we appreciate you more than you know. And if you're in the hospital, do yourselves a favor, okay? 1, take care of yourselves, listen, and 2, if you can, wait until you get back home to be a little intimate. All right, guys, if you have any stories that you want to share, by the way, feel free to drop them down below because as uncomfortable as they are, we do love reading them. And as always, thanks for hanging out with me, and we will see you in the next one.